Okay, so good evening. Thank you so much for joining me and giving me the opportunity to talk to you today. My name is Dylan Say, and I am Collaborative Cancer Care Summer Intern for 2024. So just to start, how was your day today?
My day was well. Thank you. Thank you for having me on here. I'm excited to interview with you.
Okay, that's
It
good.
was a lovely day.
So today, just giving you a general synopsis of what we'll be talking about. I just wanted to discuss your story. Tell me about yourself, your experiences, and generally your thoughts, um, and your opinions on cancer treatment nowadays, or even mental health regarding cancer. So, can you just tell me a little bit about yourself and your background?
Yeah, so I am a mom of three, a grandmother of two. I am a special education teacher for early childhood, and I am a believer in God, in Christ, and I am a two-time breast cancer survivor or thriver, should I say, winner.
Okay. So Uh, if you don't mind me asking, can you share your initial reaction upon being diagnosed with breast cancer for the first time?
Oh yeah. So it was I tell the story very often because my response kind of shocked me. Um so I remember I was at work. It was during the pandemic. I believe it was July 2020. And during that time I was teaching online and I was in between sessions with a student and I got a phone call. Or was I was either on professional development. I don't remember. I think I was on a professional development meeting. Um, and I got a phone call from one of my nurses and she broke it to me really nice the first time and let me know that my biopsy came back positive. And before I started freaking out, she was like, I just want to let you know you're at a stage zero, it just started. Um, but my initial response was like my heart started pounding. I got really scared and nervous. Like, what cancer? Like, my mind just started racing. And I remember literally hearing God say, don't worry, I got you. I'm going to use you. So that voice that I heard was something that helped push me through my treatments and the lumpectomy during the first time. The second time as it wasn't as calm and kind.
For the first time, this might sound like a weird question, but do you remember what you were wearing that day?
No, I don't. It was like a blur.
Mm,
I remember where I was sitting. I was in my room, sitting facing towards the window, because that's where my little setup was for my students. So I remember where I was sitting. I do not remember what I had on. I don't remember how my hair was because my hair was longer before the chemo. I don't remember any of that. I just remember where I was sitting and like that pounding of my heart feeling and that still voice that wasn't my own voice. Like, don't worry, I got you.
mm. That's interesting. I only asked that question because when it comes to important events in our lives, especially as something as detrimental as the diagnosis, people oftentimes remember little details about what they were wearing, whether how they're feeling that day, and what they see that day. So that's why I asked that question.
I just remember the window, the light coming in from the window, like the sunshine coming in from the window, and where I was sitting. Everything else was a blur.
Mm. So after the first diagnosis, or during after that day, do you remember how did it affect your daily routine? Did it change your outlook on anything?
Actually, I was in a very good mental space my first diagnosis. Um, like everything went very smooth. I had a wonderful medical team They heard me, they heard my concerns, they explained everything great. I had my surgery went well. Um, so the first time it was like very smooth. The only thing that was exhausting was, I would say, the radiation treatment. And I was told I'll feel tired with that, but I noticed that it was like it lingered even after the treatment. So that was the only thing, but I was in a really good mental headspace. The only thing I would say would change my perspective is it made me appreciate life even more than what I already do, and like to not, worry about things that really don't matter.
That's good. So, did it change anything that you would have normally done?
Um, so the first time, oh yes. So I was never a fan of microwaves. I would always do the toaster oven, or put my food in the oven or heat it up on the stove. So after my radiation treatment, I actually would not mess with a microwave. Like I was really strict on it. Like, no, get me away from my microwave. So it's like little things like that. And yeah, I would say, well, other than that, no.
Okay.
It's just like appreciating life, just thankful for where I was. Like I was very thankful. And I would say my connection with God got stronger. Like it built my faith even more.
Mm. Did you have like a stable support group with you that had helped you with your journey?
Yeah, so I had friends that were supportive, and so during my both journeys, my first and second time, I did not tell everyone because I just wanted to get through. And so I just my immediate family and some of my close friends knew. And then um after everything, that's when I was more open about it.
Okay.
So I had a really great support system. My children, sister, mother, my dad, like I had like only a few cousins knew, not everyone, and aunts knew, but not everyone. So it was very closed.
And after these group of people knew, did anything change about your relationship with them or your interactions with them?
So actually, it grew us in closer, like with my siblings, and so the first diagnosis didn't have as much of an impact as the second one,
Mhm.
because the second diagnosis was more intense. It was invasive, and it was further along. Like I was at a stage 2, I believe, or like 2 point something. Like it was almost a stage 3. And I had to have the mastectomy and the chemo. So the second diagnosis was more traumatic for me. Um, and that really shook my life, the second. And I think the second diagnosis is what um, shook my family, because they had to watch me go through what I was going through. Like they went through the losing of my hair, my eyebrows. Thank God I didn't lose weight, but they witnessed like the breakout. They witnessed me being admitted into the hospital just for a pimple that turned into a boil, and they had to drain it, and I had to get admitted. They witnessed me being sick and the side effects from my hands and feet burning from the hand foot syndrome and the neuropathy. So I would say that really changed our relationship. And like my sister Quinta, she was very empathetic. Like she did was doing her research on it and trying to like really understand what I was going through, and I really appreciate her for that. And I know it's hard for your loved ones to see you go through something. And we walk around with this brave face because we don't want them to hurt or worry. But some days, you can't always wear that brave face. So I think that me going through this, it brought me closer to, like, it build on our relationships, like with my mom, dad, siblings, friends, um, my children. Yeah.
So essentially, it kind of taught you to be more vulnerable, is what I'm hearing, or no?
Yes.
Mm.
'Cause I'm like, I'm good. I got this. I got this. Don't really like asking people to help me. And I was at a place where I had no choice but to get help. So I was definitely it was a humbling and vulnerable stage for me, to seek help and to accept it, and to just receive it without feeling like I owed anyone anything.
Mhm.
I had to do something because I was in a place where I couldn't do much. So I was definitely in a very vulnerable state.
How was the second diagnosis like? Do you remember anything from that day? If
Yes, I
you can
was in the classroom teaching. Um, the doctor that called me was not as sensitive and as caring as the first time. The nurse practitioner the wonderful nurse practitioner that called me the first time. This it was actually my radiologist oncologist. He called me and was like, "You're going to this is life threatening. You could die, and you have to have your breast removed." And I'm just like, "Wait, what's going on? What's happening?" Um, so I thought that was very insensitive, the way, I was contacted. He didn't even like find out if I was in a place to receive this information. He just like went right into it. So I remember being in the hallway. I don't remember what I was wearing. I think I had a white shirt on, but I don't remember. And I do remember just leaving the classroom and being in the hallway, um, trying to notify my my team for my job, to find out like my about my FMLA and all this stuff, because the way, he told me, like, you're gonna have to come off of work. And so I just got so scared. I'm in the hallway crying, like not knowing what to do, trying to find out options. um yeah, it was very traumatic, the second time.
Yeah, I can imagine. That approach seems very inappropriate for
Yeah.
someone of that profession.
Yeah, it was traumatic. But I'm not gonna let that minor thing take away from my medical team, because my medical team, they all were amazing. My breast oncologist, my medical oncologist, and my plastic surgeon, they were all amazing. Like, they heard me, they were like very supportive, very caring. The nurses, inside the chemo, when I would go and get my chemo, everyone in that department. So, minus that, everybody else, like, throughout the journey, was amazing and very supportive. So I'm
That's
very thankful for that. Yeah.
Would you say you had any were there any lessons learned from your second time? It could be from anything,
Yes.
religiously, spiritually, physically, or with treatment.
So it was everything. My lesson learned from both, from my first and second. I don't think I would have did the radiation. Um, Knowing what I know now, um, I know people always think I sound crazy when I'm like, the chemo, even though I had all the bad symptoms, I feel like was like, once you have the chemo, it does what it does to your body, then it leaves out the system. Whereas the side effects I get from radiation, it still bothers me. But I feel like everyone is different, and it's not a one size fit all. So it's just a matter of knowing your body, because some people do well with radiation and some people don't do as well with chemo. Um, and I would say that my mastectomy, the surgery that I got, I probably would not have got the reconstruction. I probably would have just went flat chested and not went with the reconstruction if I knew more information. Once again, it's about like knowing your body and knowing that everything is not a one size fit all. So I would just, my advice would be just really do the research um, on the procedures, the treatment, and ask questions. Like self advocacy is so important. And if you have the right team, which I had a great team, they won't feel no type of way because you're asking questions. They'll be able to answer those questions and make you feel sure of what you've done. Um, like my reconstruction came out fine. I love it. It's just the continuous pain that I feel in my back from having the muscle removed and put in the front. I didn't know the pain would last so long. And once again, it's about knowing your body because my doctors didn't know I was still going to feel this pain. Um, and they're still trying to figure out like why I still, have this pain. So I would say just knowing your body and really paying attention to your body and being able to advocate for yourself. And spiritually, definitely got me closer to God because having a second diagnosis, this one being more invasive, going through the process, like I had a journey throughout my healing process and my treatment. Um, and just trusting God because there were times where I was like, why am I going through this? What did I do? And then it's like that reminder from the first time, it's not about you. It's I'm gonna use you to help someone else. So just realizing that he really does give his toughest assignments to his toughest soldiers. So that's what I'm looking at myself as. And it's just like and I'm blessed because me going through this, I've been able to help other people go through their own cancer journey, whether it's breast cancer or other forms of cancer. So I'm definitely thankful for that. I was able to work through my whole treatment, um, through the chemo treatment and the radiation treatment while in a pandemic teaching children, and I was healthy. So once again, I would say, just knowing your body and what your body can do. And I believe me working is what pushed me and kept me going, instead of just sitting home thinking about my situation, thinking about where I am. Um, I was able to just, move forward and not, just sit and say, why is this happening? But how can I be used while this is happening? So it's like it changed my perspective, definitely.
It seems like you kept a really good, like, positive outlook given your circumstances and also the pandemic. Did the pandemic, I know it's a typical question, but did that um, drastically affect anything in your daily routine besides teaching online or your treatment?
No. At the beginning, I when I started the chemo, I was a little scared because they tell you your immune system drops and things like that. But that's where my faith came in. And I just remember praying on it, like, okay, God, you have me going through this. I just started teaching. If I'm supposed to not be teaching, let me know. I got the okay after praying, and I was able to work through the pandemic with my mask, and I didn't catch COVID during my whole treatment. I actually caught COVID after my treatment, after the surgery, and it was so funny how I caught COVID right before each treatment. So it was almost like my body was preparing its immune system right before the treatment. But I was able to work close with my students, and I was very thankful I didn't get sick or anything. And that's all with the grace of God. So it was scary at first. I tried to like stay in the house. I didn't do a lot of family events, and it was just like work, home, chemo, work, home, chemo. and I would like take walks in the park just to get out or whatever, and try to find like little things to do in the house. But yeah, that was pretty much my day.
Regarding your routine, taking walks sound really nice. And it sounds like a good kind of like an escape from that routine of chemo, school, and uh, work, I think is what you said.
Yeah.
Um, did you do anything else that would help mentally, like read, write, or pick up like other hobbies?
Yeah. So I picked up some hobbies. I started YouTubing, like doing finishing. Like I had already started before my treatment. So I continued that with the Miss A read alouds. I started a podcast. I wrote books during children books during my and I did a lot of I wrote poems during the treatment. I vlogged. I didn't put any of this stuff out. It's like all sitting in storage, just sitting there. It was just like something for me to do. Um, the only thing that's actually out there is the Miss A read aloud and the YouTube.
Hmm. And would you say any of those helped you?
Yes. And
Mm.
spending time with my grandson. During that time my grandson was born, and hanging out with him was my highlight. Like he was definitely my him and family, just like hanging out with family and friends. And like I said, doing my walks. Um, Sometimes I would go for drives with my friend, and that was what kept me sane during that time.
It's good.
Prayer,
I'm
a lot
really
of prayer,
happy.
church.
How did you sorry. What are some of the biggest challenges and how did you overcome them besides the treatment or unless the treatment was one of those challenges?
Um, the only challenge I had with my chemo was the burning hands and feet.
Mhm.
Like the bald head, I embraced that. I just had the neuropathy with my hands and feet and the hand foot syndrome. Um, that was the biggest challenge. Trying to work while doing that. And I would say um, trying to keep my mind in a positive space. So trying to keep that mental stability is that was like a constant struggle, like waking up and making that choice to be like, today is going to be a good day. And even on the days where it wasn't great, like giving myself the space to cry and be okay with it was hard because I felt like I was complaining and I didn't want to complain, or I felt like, I got to be strong for everybody else. So I would say that was one of the challenges. And trying not to stress or worry while healing, and giving myself like grace to just relax and sit still. That was a challenge, trying to sit still while I was going through the motions.
What would you do when you found yourself like restless or worrying?
That's where I would start writing or get on and do like the podcasting. Um, I would either write the books, write a poem, um, go for walks because I found, or play with my grandson, um, call up a friend or a family member just to, or go for a drive or drive with one of my friends. It was like just trying to do things to get out my head because sitting still was hard for me because I'm so used to like getting up and going. And that was a time where I had no choice but to just like sit because my body was tired, but my mind was, thinking that I was still able to be active and going. But my body's like, I'm tired, I need rest. So um, just trying to force myself to take naps or to sleep or like binge watch movies and stuff like that.
It's good. What would you write about? Whether poems, would you journal?
So I journaled, but a lot of my journaling was video journaling. I found it easier, and I wanted to capture the moment of how I was feeling and the emotion. And I felt like it was easier to do it via videos instead of like writing it. Um, and I also wrote poems and I wrote children books um, during that time. And then I would like create different topics I wanted to do for my podcast. And that's really it. Yeah.
This all sounds so
I'm
nice though.
crying. I'm
To
like in crying. I'm crying.
to be able to do all of those things and try to distract your mind. That's
Yeah.
still really good.
Yeah. And praying. A lot of praying, crying. Yeah.
What are some things that healthcare providers could do to support you? Were there anything that could have been altered during that time?
Like I said, I was blessed to have a wonderful medical team that listens. But the only thing I would say for the healthcare profession, um, everything is not a one size fit all. And, it's really important to listen to your patients when they're saying something's bothering them, something's hurting them, um, because I feel like a lot of times it's that generalization and they put everyone on the same spectrum, knowing that we are all individuals and our bodies react to everything differently due to hormones, the way we eat, our DNA, genetics, just anything can factor and play a role in how someone responds to something. So I would say instead of saying, oh, that shouldn't hurt you, or that shouldn't bother you, or you shouldn't react to this because this is what the studies show, but instead listen and say, what's happening, what's going on, how can we help you? So I would just say a lot of times it's that generalization that um, it's a one size fit all, and that's not always the case.
How would you react to these generalizations when they when they happen to you? How would how would you react to them?
Um, I was just learned this process definitely taught me how to advocate because I know my body and I listen to my body. I was a big advocate for myself, along with my friend that was in the medical field for over 20 something years as a nurse practitioner oncologist. I was able to reach out to her, get some questions and information. And um, I had another friend that was a OBGYN. So it helped me having these people in my life that were in the medical field that I was able to talk to, but also me having a medical background as well, and just knowing my body and knowing what I respond to and how I react allowed me to be able to advocate. And sometimes, doctors will try to downplay something because it doesn't fit, the statistics that they're reading on. And that's where the advocacy comes in. And it's like, no, this is what's happening to me. I know this is not what the research is showing, but I'm telling you what my body is doing and what's happening. um and just advocating for yourself for whatever it is that you need. And I think that this process definitely helped me become a better advocate for myself.
You had mentioned earlier that one of the lessons that you had learned personally was learning to be more vulnerable with people, learning to ask for help and not rely on yourself. Um, was there anything in particular that you have gained from that since you had changed your mindset?
Yes,
As
that
far as
it's
relationships?
okay. It's okay to get help. It's okay to receive help. I'm still a work in progress with that, but that there are people out there that really do want to genuinely help you with nothing in return. And it's okay, by being vulnerable, it's giving yourself grace. We walk around in this world where we feel like We have to have this mask on that we're tough, we're strong, but it's okay. And actually, it allowed me to come into my soft era where I'm just like, I don't have to be tough all the time. I could be soft and allow others to pour into me instead of me pouring out. Um, and that's a really good feeling to have.
What
So,
advice oh,
oh, sorry,
sorry.
go ahead.
No, you could continue.
No, I was just gonna say, so that just helps me give myself grace. That was all.
What
Yeah.
advice would you give to someone who had just been diagnosed with breast cancer? Because I know everyone's reactions to their diagnosis is different.
Oh wow. That's so hard to say because you don't know where people headspaces are and their situation and their living situation, how their support system is,
Mhm.
because everyone is different. Um, I don't like to push beliefs on anyone, but I would say whatever you believe in, lean in on that, whatever your belief is, and just lean in on your faith, whatever your belief system is, your faith system is, lean in on that. um if you can find a tribe, find it, create a tribe and lean in on them. Give yourself grace and do not think that you are going through this because you did something wrong. Look at it as you're going through this because you're going to be able to help someone else get through it. And a lot of times, we find our strengths in our weaknesses. So, um, use the situation to try to find your strength because it's there. And when you don't have that strength, give yourself grace to just be vulnerable and cry. And don't always try to wear that mask. It's okay to put the mask down and allow yourself to for people to see what it is that you're feeling and going through, because people can't what I learned is people can't nurture me if I'm walking around acting as if I don't need to be nurtured because I have this mask on that I got it. So I'm walking around like, why is everybody acting like I'm not sick or I'm tired? Oh, because Tasha, you're walking around acting like you have it all and you don't need help. So it's people will treat us how we allow them to treat us. So if we're walking around like we have it, then it's not others' fault why they are looking at you as strong. So just give yourself grace and um, be vulnerable. Find your people. Find your tribe to love on. And if you don't have one, to create one. There's so many um, support groups out there. Like I was able to join a couple of support groups on Facebook, thanks to my friend Wendy sending me over to some support groups and just reaching out. And you have this whole community and you have people that are feeling what you're feeling, going through what you're going through, and then you're like, oh, so it's not just me. Like just recently, I still like it's been since 2022, since 2 years now, since I've had my treatment and my mastectomy, my last treatment and mastectomy, and I still go into this group because now I'm experiencing like really dry skin for some reason. And I go on there and then you see that other people are experiencing the same thing. And you're like, oh, so it's not just me. I'm not going crazy. There's not anything wrong with me because having a diagnosis not once but twice, you're always looking at in that fear. You're trying not to walk in that fear that it's going to come back again. But it's like, no, you're healed, you're good. This is just your body responding. um so like trying to walk away from that fear and leaving that fear behind me and just knowing that if there's anything that I am questioning, I don't have to walk in fear, but I could just log into my new tribe on in this support group and tap in and see who's feeling what. So it's a scary thing, but you don't have to do it alone.
I think that was really beautifully put together. I think you articulated that really well.
Thank you.
Are there any goals or current aspirations that you're pursuing now that you've overcome these challenges?
Wow, you're good with these questions. So, currently, yes. So, as I mentioned before, that voice that I heard, that I am going to use you. Don't worry, I'm going to use you. I'm going to get you through this. Now that I'm in 2 years, I I want to use whatever my gifts are to help others. And I've lost people that are close to me, like during this battle, that you know, they did not get to, you know, have that privilege to say that they were winners of their battle. They succumbed to it. So that always is like that survivor guilt, where it's like, they didn't make it. So, but I did, not once, but twice. So it's like that. I have to do something. So right now I am just finishing my teaching career, and I have a couple of other things that I'm working on, and just trying to collaborate and be used to speak to other women that are going through their breast cancer journey or their cancer journey, because it's not just breast cancer, that cancer is affecting everyone in all different parts of their body. And I feel like the struggle, no matter where it affects, is still a struggle, and we all need support, and we all can relate to the impact that it does. Like once you're diagnosed, your life is never the same. You know, it's never the same. Um, you constantly have that question in the back of your head, like, should I eat this? Should I do this? You know, just try not to walk with that anxiety. So I feel like we are a community that need to support each other. So right now I'm just trying to find different avenues on how I can be used to be a support system.
So essentially becoming like a pillar almost for other people.
Right, right. And an advocate, for those that are going through.
What do you think is the most important message about breast cancer and mental health that needs to be shared with others? Um, just basing off of what you want to do now, pursuing that aspiration.
Okay, so one of the things that I'm working on with the goals is life after your diagnosis, life after treatment, and what that looks like. And once you're diagnosed, especially if you have surgery, like me having a mastectomy and the muscle removed, my body, now I have a new normal, whatever normal, means. So it's like, what is my new normal? What is now my baseline? So relearning myself, and re relearning um my new baseline and where I'm at, even mentally. Um, it's not the same. And I think people see you, you know, a lot of people see, oh, your hair grew back, you look so good, but mentally you're still working on that. You're still working on, some people have a hard time with accepting the scars and the impact that it had on their bodies. Um, I've embraced my scars with in my, like, sometimes I make jokes about it, because that's just my dark humor.
Mhm.
But it's still impact though, it's like learning to re-love yourself again. Um, Dating after treatment, dating after surgery, dating after, like, when we go through cancer, it takes us, a lot of people, it takes an impact on you financially, because you're not able to work the way you used to work, or you have to buy certain things to take care of yourself and care for yourself depending on where you are. So it's like your whole life has been altered mentally, financially, emotionally, physically. So it's spiritually. So it's like trying to reset. It's like basically slapping on those paddles and like, rejuvenating yourself, reviving yourself again, like clear, and then giving your life a whole shock again to bring you back and figure out like, okay, this is my baseline. What are we going to do? And how do we get not back to where I was, because I'll never be there, but how do I move forward, with where I am?
It sounds like you have a really good head on your shoulders. At times that you're feeling, I guess, essentially lost or restless, do you do anything different to help just bring you back down?
I do a lot of praying. Like I said, I don't know what people believe in their faith, but my faith has definitely grounded me. And there's times where I'm not gonna lie, like, oh yeah, every time I go and pray, yes, I do pray, but sometimes it I need more. So I have to reach out to someone else and just ask them to pray for me or pray with me, or I'll have to reach out to someone and just vent, finding that trustable ear where I can have a safe space to vent. And therapy is amazing, um because it's like having that safe space where you could just vent and talk about what you're feeling, how and what you're going through, because sometimes it's good to get it out. I know a lot of people say journaling, but I do better by expressing it verbally, sometimes, and then I also journal. But there's sometimes my mind is going so much till it's too much to write down. So like I said, I'll record, like do a voice record, or pick up a phone and just speak to someone to help bring me back, so I don't go down a rabbit hole of self-doubt and negative speaking over myself. And that helps a lot, and like reading different books um helps as well.
What kind of books do you read?
So I do a lot of like spiritual and self-improvement books, and also, books that have to do with my field that I'm in. And so I thrive off of improvement. So if I'm feeling like down and is I have no control, if I'm going and I'm learning something new, or something, yeah, something new, whether it's about my craft with special education, or learning something new in the endeavor that I'm going into now. I don't want to speak on that right now too much, but that drives me. That gives me purpose. And it's like knowing that you have that purpose. My friend always says that, find your purpose and your why, and push off of that. And then I'm in this like teaching program, and we speak a lot about like our purpose. I'm in this teaching fellowship, clock teaching fellowship, with the Teachers Lounge, and we speak a lot about purpose. So that's where I'm at right now. Like I feel like when you're moving in purpose to help others, it kind of takes you out of that down space. Um, so trying to like keep myself there, and when I'm losing that drive, always finding someone to help, refuel me.
Is there you had mentioned therapy before. Would you say is there anything that you would like healthcare professionals to do more regarding mental health, especially mental health in oncology?
Yes. I know it's two separate things, like degrees, but it still connects, because when the body is impacted and your health is impacted, your mental health is impacted. So it's like it goes hand in hand and it's intertwined. Um, so I think like, you know, finding that baseline and helping their patients get connected with someone that can help them during that process. You know, I know that they say a lot of places have social workers, but that information is not always given to everyone with the social workers. And a lot of times, social workers, they look to help you like what you need, like financially or support, like something or being connected somewhere. Whereas I feel like the mental health part is not mentioned, like that part is not spoken about, and that is important because to me, in order to survive, that plays a huge part on your mental health plays a huge part on your survival. um because if you're mentally not feeling it and you're feeling like, oh, you know, I don't want to do this, I don't want to push, then your body is going to respond to how you're feeling. um so I feel like if they can intertwine the two together, which I'm very happy with collaborative cancer care, you all are making that step to put health care and mental health together, which is so important. Um, I think that's like a game changer with um, the medical industry, putting those two things together instead of keeping them separate.
I definitely do think it's still um, I guess an idea that's still new in the field regarding mental health and oncology. Um, but those are all the questions that I have today for you.
No, thank you. Yeah, that's crazy that it's like that because I think even the health professionals, you know, they're impacted too. So their mental health is important in order for them to be able to care for their patients the right way. So it's not just the patients that need that mental health nurturing, but it's also the medical professionals that also need it. So I pray that it picks up and they make that connection and start seeing that they're connected and they work together, not as two separate entities, that they're, you know, they go hand in hand. And I thank you so much for having me.
No, thank you for giving me the opportunity to talk to you and telling us your story. I really appreciate it.
I appreciate it.